Hi everyone, it's always good to be with you. We're about to have a conversation with an eminent guest. But before I get into that, I just want to say one more time that whether we're separated by geography or distance of one sort or another, I feel a huge sense of connectedness to all of you. And I just want to hear myself saying that out loud. I love knowing that I can get feedback from you. I love knowing that other people are going to put in their own interpretations, ask more questions, and let me know that you're thinking. To the matter in hand, my guest today is an eminent American cardiologist, Dr. Peter McCullough. For people who've been following my content and who've been paying attention to a lot of what's going on, he'll be a familiar voice and face. He's very outspoken about everything to do with the so-called pandemic. Before we get into that conversation, and it is a fascinating conversation, let me remind you about how to support this channel. Basically, it's via patreon.com. Go there, look for me, part with a little bit of cash, about the price of a cup of coffee every month, and you become part of the family. You'll see all my new content ahead of time, and you get exclusive access to question and answer session, the occasional competition, all sorts of things that make it worthwhile. But it'll be made better and enriched by you being there. And just to let you know, the upcoming interview was filmed against a green screen. So after the titles, my office background will disappear. You'll be confronted with a coastal scene. We chose the background because, as you know, years ago I was involved in a series called Coast. We filmed at lots of coastal locations. Let me know if you spot which one this actually happens to be. Anyway, let's get down to it and let's hear from Dr. Peter McCullough. My guest today is Dr. Peter McCullough, whose face and voice will be very familiar to many. He has been, always was, one of the most forthright voices questioning the official responses we all endured as the COVID story unfolded. He paid the price and continues to pay the price for his outspoken honesty. But thank you for joining me today, Doctor.
Oh, so great to join the show. I think we're kindred. You know, I'm Scots-Irish.
And, excellent. That can only help.
Yeah, so you probably can tell by my name. Although we've lost the brogue over time.
Well, we're still brothers under the skin. Excellent. There are so many areas, health-related matters that we could talk about even more broadly. But I think what I want to hear from you about today is the content of Robert F. Kennedy Jr.'s recent press conference detailing the soaring rates of autism detected amongst the American young. What's your reaction to the numbers? It's something like 1 in 30, I believe.
You know, these are stunning statistics, and they're all disclosed in an April 17th, 2025 CDC report. It has over 60 authors on it, chronicling a meteoric rise in the rate of autism spectrum disorder. So the CDC uses 16 sites across the United States where they gather information on autism. It's under a research institutional review board. They have lots of internal checks. It's not just codified data. They understand who's been referred for learning disabilities. This is the real deal. It's not an artifact of increased screening or detection. And they, since 2020 to 2022, they've noted another biannual jump in the rates of autism. We now are down to 3.2% of American children. This is a very solid estimate. The ranges can be less than 1% in Laredo, Texas, to as high as 5.3% in California. So there's a tremendous range.
And within that, when people hear the word autism, let's say, it's a spectrum disorder, so that it can be of greater or lesser severity. Within this soaring proportion of youngsters being diagnosed with autism, how severe? Because I've heard tell of in some cases we're talking about people who will never be able to function, never have what we would regard as normal adult lives. How many of that 1 in 30 or whatever the proportion is are at the very, very damaged end of the spectrum?
Right. So the number is about 1 in 31. And by the way, it's the same in Europe and the UK. It's the same. In fact, I just reviewed a paper through the pandemic from the UK. It'll be coming out of my Focal Points Substack. The rate they had in the UK was over 9% for autism spectrum disorder. So it's up there as well. The CDC report discloses over 60% of those children needed special needs education. So that's a proxy that they were not at the same learning level as normal peers. In the published literature, it's about a quarter of those with autism are severe, to the point where there's repetitive behaviors, head banging, uncontrollable shouting, kind of guttural utterances, auditory processing. So you'll see the small children wearing the noise-canceling headphones if you go out in public spaces. That's almost certainly a child with severe autism. Trouble with toileting. Some actually, never really learn how to use a toilet the rest of your life. So it's about 25% of that number. And, when I was a child, the rate was 1 in 10,000, and now it's 1 in 31. What's really disturbing to me is the medical orthodoxy, the mainstream medical establishment and the mainstream media seem unconcerned. The CDC seems unconcerned. In their April 17th report 2025, when we got to the conclusions, they didn't say this is alarming, we need research, we need to stem the tide of this, find out what's the risk factors for this. Instead, they just concluded, oh well, we'll need more special needs education and resources.
So, what is the likely cause of the soaring rate of autism and other behavioural problems? What is it?
I recently gave a keynote speech on this at a major meeting. I'm an internist and a cardiologist, so I am seeing autistic young adults in my practice in increasing number. And I'm an epidemiologist. I study the distribution and determinants of disease. And I can tell you autism is not caused by a single exclusive factor. It's not. There are inputs, and there are multiple studies to support this. So, for instance, there are common genetic variants. No genetic mutations. There's no autism gene, but there are some genetic predispositions, but they're common in populations. Older adults, so men over 40, women over 35 conceiving children, that's a risk factor. It's a minor risk factor. Premature delivery of babies, that's a pretty big one. So if a child is born before 37 weeks, in a meta-analysis, about 20% become autistic when they grow up. So they're not born with autism, but they, in a sense, convert to autism somewhere between the ages of 2 and 8. And I think the biggest risk factor, though, the biggest, most modifiable risk factor is combination vaccination. And it was first described by Leo Kanner, a child psychiatrist in 1943, where 1 out of the 11 children he initially described with autism, they converted, they were normal, and they converted to autism after the smallpox vaccine.
Well, I mean, obviously, I'm well aware of the fact that here we had Andrew Wakefield, many years ago now, who drew a link between the MMR vaccination programme that my children all went through and increased incidence of autism. It terrifies me now when I think about it. But myself, my wife, and I, we didn't hesitate to get our children the MMR vaccine, and we listened to Dr. Wakefield being roundly ridiculed and disparaged across the piece by the medical orthodoxy. And now we look back at that time, at that story, and we just thank our lucky stars.
Mm-hmm. Yeah, my wife and I the same. Our children received all the vaccines. I personally received all the vaccines, and I traveled. I took more vaccines. So a few principles about vaccines. They are far safer when they're given individually as opposed to combinations. It makes sense because when you combine multiple different products in a single shot, you can evoke more inflammatory side effects. They're far safer when given later in life. So when you and I were children, we took the single measles shot, for example. I got it at age 2. By age 20, I entered medical school. I didn't have any measurable immunity, so I had to take another shot. And then by age 28, I was a fellow, and I still didn't have any measurable immunity. By that time, all they had was the MMR. So I took 2 more MMR shots at age 28. Well, taking an MMR shot at age 28, in my estimation, is far safer than blasting a child in a very early age when their brain is developing.
You mentioned that there are other factors, the genetic factors, the premature birth can play into it, but presumably during the last lifetime, those factors haven't necessarily changed for any radically identifiable reason. But it's the increase in the number of vaccination products that are introduced into babies, very young infants. That's the changed factor. And yet you say that the medical orthodoxy and the mainstream media just refuse to look at the elephant in the room and see it for what it, well, let's say, is.
It's true. It started with the seminal observation by Wakefield, published in Lancet in 1998. That was a valid paper. We accepted it. People read it. They started to get some concern. And then it was several years. Matter of fact, it was over 10 years where there was enough kind of political influence, I think, from the vaccine manufacturers and lobby, where ultimately that paper was withdrawn. After a decade of being a valid paper, authors were pressured. Wakefield himself says he, was threatened with professional reprisal. This is common for seminal observations. So this is very important. So when Semmelweis in the mid-19th century discovered that washing your hands prevented infections when doctors were doing female pelvic exams, women after they delivered babies, when he made that discovery, did the research like Wakefield did, and published it, he wasn't accepted as a hero. Just like Wakefield, he was censored and debunked and decredited, castigated. He actually died 20 years later in an insane asylum. And then Lindner and others came forward and said, oh yeah, washing the hands is important. But it took 20 years. When Sir Austin Bradford Hill presented the data in 1949, unequivocally that smoking caused lung cancer, he was roundly ridiculed, rejected by the medical community. The doctors were smoking, nurses were smoking, doctors were advertising cigarettes. No, cigarettes were safe. Papers published on this. It went all the way to 1964, Luther Terry and the Surgeon General report, where they called all the chiefs of medicine to Washington and said, listen, bad news, smoking causes lung cancer. So we're in the same situation now, where Wakefield made the seminal observation in 1998, and here we are, 2025. And you know what? The public seems to be far more aware of this and willing to recognize it than the medical community.
Well, I hear what you're saying, and I understand it also to be the case that it's across the world. It's in Europe, it's in the UK, and so on and so on. But let's say, in America, your homeland, why aren't people terrified, frankly, by the prospect? Because 1 in 30 people being affected in this way, and a quarter of those being so affected that they can't and won't live a normal adult life, I mean, that will change the fabric of society. That will mean that everyone is daily encountering multiple people with these spectrum disorders that bar them from functioning normally. I mean, that's something that's a prospect to be horrified by, that kind of societal change.
It's existential to humanity. It really is. Sociologists, historians, they should be alarmed at this point in time. Last night on CNN, Jake Tapper had on a mother of an autistic child. And of course, in the United States, our media is, in a sense, opposition politics. So CNN is opposed to the current administration, including RFK. And this woman was stating, listen, my child doesn't have problems toileting. He's able to work a low-level job, and and the boy looked like he was about 20. He hasn't started dating yet, so there's been difficulties there. She goes, I'm not interested in what's causing this. I just want to know how to best manage this. So I do think there are some parents who are, in a sense, in this position now, and they're just scrambling. Autism is grossly under-researched. There's almost no major research programs. By this time, we should have 100,000 children in a large prospective cohort study. We should have huge randomized trials. There's almost no drug development at all to treat autism. There are types of studies, there's been studies of the microbiome and other strategies. Just a handful of autistic kids have been evaluated. I can tell you this is existential. This is so big. It's being ignored by mainstream media. It's being ignored by your agencies in the UK. It's the same all over. Japan, UK, Europe, and all westernized societies that have accelerated mass combination vaccination, they are seeing these terrifying rises. By the way, the transgender crisis, which has really just been set on fire in the last few years, the vast majority of transgender young people doing this have autism.
So what's that an expression of? Why is there a correlation there?
The studies show that autistic children, they have trouble communicating and fitting in with their peer groups. They feel ostracized. Many times they're suggestible. They appear to be influenced by this, flood of pornography now coming into the schools. And when they're approached by a counselor and you suggest maybe they should change their genders, they tend to take this gender journey. But there's been multiple studies, a big study from the UK by Warrior and colleagues, a large fraction of the drivers for a gender change are rooted in this now autism epidemic.
It feels like it has. There are many facets to this, but it has seemed to me for the longest time that there's an underlying anti-humanism about all of this. The whole AI, the transhumanism, the blending of biology with technology, speaks somehow to a lack of awe about what it is to be human and alive, and that we've even got to the point in the early part of this millennium, as it being a commonplace for so many people to be so negatively affected by a medical procedure that is driven by the appetite for profit more than by anything else. But that there is this contempt that humanity is being changed, and there's a shoulder shrug as though it doesn't matter.
Well, in many ways, this new computer online kind of environment, almost a virtual environment that people can live, is kind of conducive to those with autism. Remember, a fraction of those on the spectrum have what's called Asperger's. Asperger's is actually the name of a doctor, Dr. Asperger. They actually have exceptional abilities. So Asperger's, exceptional abilities in computers or music or electronics or engineering. They're very, very talented people. So there's some convergence between this technological advancement that we're in. our generation has so far managed the greatest velocity of change of any generation in history. Remember, for generation after generation, people were paper and pencil. And outside of electrification, which occurred around 1910 in the United States, outside of that, we've gone from paper and pencil and telephones that were shared, in a party line on the street, and phone booths, all the way to, an entire computer in our hand. And we don't even need to go work outside the home because everything is brought into us. So there's a convergence here. I agree with you, but autism is a neuropsychiatric disorder for sure. And the children are born normal. The classic vignette is a child comes in for a well baby visit. They're perfectly normal. They get a blast of vaccines, and in the United States, between 12 and 15 years, it's about 16 different products given at once. They're given in kind of bundled shots. But a child goes home, gets very sick, gets a fever, and then has a seizure. It can result in one of two outcomes. One is sudden infant death. If the parents aren't around, the child can die. Or if the child survives, then they appear from that point in time neurologically damaged. They regress, and it's almost immediate. The parents report this. We know that the high fever is due to cytokines. These are inflammatory factors responding to the vaccines. They surge into the brain, and they cause brain damage. And there are multiple papers. There's about over 200 peer-reviewed papers showing that the biological basis of autism is immune system dysfunction. Something is triggering the immune system. So the data fit. So in the United States, about 3 to 4% of children per year have a febrile seizure of many causes, vaccines, infections, strep throat, what have you. A paper by Nielsen in Sweden, very important paper, showed if a febrile seizure occurs in a child before the age of 9, that there is a 40% chance that child will develop a neurologic disorder. Attention deficit disorder, autism spectrum disorder, various tics, seizures, motor disorders. The Swedish call it the essence grouping. And so that now this makes sense, right? So if 4% have a febrile seizure, 40% of them convert to a neurologic problem, it fits with this 3.2% and growing number. Now, of interest, it can't just be due to increased screening for autism because the other neurologic disorders are going up as well. So, for instance, tics, which are readily identifiable facial motor disorders, they are also on the same rise as autism spectrum disorder.
The complacency around it is terrifying. I've used that word already, but the fact that these things are being observed at scale and the response is only, as you've outlined, for people voicing a desire to be able to cope with it, to address the symptoms, as it were, rather than to find the solution. And I've heard over and over again in the last few years, when I was paying attention to the COVID story and to what was being done via these gene therapies, that we're playing around with everything comes back to the immune system. And I've heard the immune system described as like the Pacific Ocean, as it confronted the earliest navigators of incredible extent and incredible depth, and we're paddling around on the surface of it. And yet there's this arrogant determination to influence, affect the immune system via the vaccination program to as yet non-understood ends. I find that terrifying.
Well, it's basically become like a religion. It's what we call vaccine ideology. And it goes way back to Edward Jenner in the UK. I mean, the arrogance. Back then, they had no test for smallpox. They couldn't confirm smallpox versus measles or titariasis rosea or any other rash. So each time a vaccine was developed, they didn't even have a way of confirming a diagnosis of what they were vaccinating for. And the same is true for measles, the same is true for polio. So the hubris here is that, and how the ideology goes, is that mankind is vulnerable to infectious diseases. We're vulnerable. But through the brilliance of science, and mankind can improve upon God's creation. And this is the ultimate hubris. And this was taken to such an extent, and it's topical now, that Pope Francis, who just died, he issued production of a coin, a papal coin, a 20-euro coin. And this is during the pandemic. And it's a picture of a young boy. And he's about to receive the Eucharist, the body and blood of Christ. But instead, he's receiving a vaccine. This shows you that, and there's always been money and power around vaccines. Even, back to Jenner, he was at the right hand of the king. And we've seen Louis Pasteur and the incredible arrogance there. There was no confirmation that his vaccine ever prevented rabies. And how all these vaccines are developed early on is they're almost like a miracle. Here, this works, take it. And in fact, during smallpox, people were forced to take it, otherwise be jailed. It led to the Imperial Vaccination League in the UK, and then the Anti-Vaccination League, and there was tremendous protests. I mean, that's our legacy. So people say, well, you're surprised about protests over the COVID-19 vaccines and mandates. Well, we go back several hundred years. It was the same thing.
It's astonishing. I saw that you had retweeted recently, I think, by a post by the Vigilant Fox about aluminium. Scientists have found aluminium in the brains of children with autism at levels higher than almost any human brain tissue ever recorded. Aluminium is a known neurotoxin, and it's not supposed to be in the brain at all. How is aluminium at these levels entering the brain? I mean, you tell me. I understood the blood-brain barrier and so on. How is it coming to pass that there's this terrifyingly high build-up of aluminium in infant brains?
Well, let me tell you, any metal that gets into the body and the bloodstream is typically bad news, and it readily gets into the brain, like lead, aluminum, gold, gadolinium, by the way, which is used for MRI scans. These are all forms of metals. They get into the brain. There's been a great concern that vaccines, that there are trace amounts of mercury, thiomersal, and aluminum. And when we gave aluminum in high doses historically to dialysis patients, and I remember those years because I was practicing at the time, to try to bind the phosphate in the GI tract, the aluminum went in the brain, and aluminum toxicity in the brain causes more of a dementia picture. The same is true with lead. So I don't think it's necessarily mercury or aluminum in the vaccines, which are adjuvants, that are causing autistic changes in the brain. It's far more likely to be the cytokines and this acute febrile episode. And believe it or not, some of this may be preventable with better education on how to manage a febrile seizure. So, parents should have both acetaminophen or paracetamol and a non-steroidal like ibuprofen available. Be adept at using tepid baths, but we can't have the children get such a high fever to suffer a seizure. And here's the dilemma that we're in now, is that many of us who understand this, we're at the age where we could become grandparents. It's very important. We could become grandparents, but now we know. When we were parents ourselves, we didn't know. And can you imagine the dismay and the angst that grandparents are going to have if their children go forward and allow these batteries of vaccines to be administered and their grandchildren develop autism, and then people say, you know what, we saw this coming, we warned you. And, parents right now of autistic children had no warnings. I've talked to many of them. There's no warnings. They said, listen, we walked in, our doctor said to do this, we said, okay, we did it. And so historically in the United States, only 2.5% of Americans decline childhood vaccines, typically on religious or ethical directives like the Amish or the Mennonites and others. Now that number is up to 10%. So in a recent study by Mawson and colleagues from the Florida Medicaid program, 49,000 children in the Medicaid program cut at data at age 9, 10% of them had no Medicaid visits for vaccines. So it's kind of a proxy for not receiving a vaccine. Now, they could have gotten vaccines outside of a Medicaid visit, like at a school program, but it's a proxy. And the rate of autism in that group was 1.1%, and the rate of autism in the vaccinated group was 2.9%. So it just gives, and among the children who had the most visits for vaccine administration, they had even higher rates of autism. So all the data we're discussing is cohesive, meaning it fits together scientifically. And the mainstream media and the medical orthodoxy cannot continue to turn a blind eye to this. It's going to consume us from a societal perspective.
What does it take, after all? I mean, there's now RFK Jr., at the highest levels of the administration. He is speaking about this. He has been concerned. He has been audibly concerned about all of this for decades. Surely now, in the United States of America, you would be expecting to see change.
There appears to be complete acquiescence. There was a recent paper in JAMA, Journal of the American Medical Association, arguing that medical schools should intentionally recruit autistic applicants so we can have more doctors with autism, so they can relate to autistic patients. It's astounding.
But do you have a sense, say with someone like Kennedy in the position that he now occupies, that you would see a sea change? Let's say in relation to the mRNA platform, would you expect to see that dealt with, withdrawn, suspended, or will that grind on remorselessly with the rest of the juggernaut?
Usually, if we use the example of hand washing and smoking, it takes many decades. Now, since the time of Wakefield's publication, those decades have gone on. But do you know, even in the last month, in the major literature, New England Journal of Medicine and JAMA, they again cite Wakefield and say he's debunked and discredited, and then he started all of this skepticism on vaccines. Well, listen, if his observations were so wrong and so scientifically invalid, why do they keep bringing him up?
Well, precisely. But it's this inertia. If you've even got, as I say again, if you have someone like Kennedy in the position that he's in, with the attitudes and the understanding that he has long professed, if there won't be change under his bailiwick, then what does the future really hold?
Well, I completely agree. In my field in cardiology, for problems, emerging problems, we have what's called Bethesda meetings, Bethesda, Maryland, and it's the National Institutes of Health, the FDA, CDC, other agencies, industry, and we have, it's usually well attended, and there's a schedule of presentations. These were all suspended during COVID. They've never been restarted. We need to start meeting, invite all the major players to the table, and start reviewing the data on autism, on vaccine safety. I mean, don't forget the COVID vaccines are still being used. And when I give big public programs, thousands of people attend. I ask a question. I ask, how many of you in the crowd know somebody who's been injured, disabled, or have died as a result of the COVID-19 vaccine? 85% of people raise their hand. So the public knows. The public is actually not taking vaccines as adults. The only group that's taking vaccines because they're essentially forced into it are children. So we have 70 million children in the United States. We had 9 million actually take COVID-19 vaccines last year. It's probably more than the adults did. In Brazil, they are forcing children starting at age 6 months to take COVID vaccines. And if parents decline, they get essentially a U.S. $30,000 fine levied against them, or they get put in jail. And there's been published surveys of Brazilian judges who believe it's absolutely essential for public health for the children to be vaccinated against COVID. They don't care so much about the adults, just the children.
Why, or when will the what is now, I would say, consensus that these products were neither safe nor effective going to make any difference? Why are millions of American infants being given these products when we absolutely know that they don't prevent transmission because they were never tested for that in the first place? It's like, that old adage about endlessly repeating an experiment expecting different results being the definition of insanity. Is it all about the religiosity that you already mentioned? Worshipping at the altar of vaccines, or is it just the profit motive, or is it a dreadful combination of both?
Well, clearly, some are profiteering, particularly the companies, to the order of tens of billions of dollars. This is unprecedented in terms of revenue for a new product. But think about the psychological ramifications of a doctor who is at a major medical center. The major medical center mandated the vaccines, that they were so important. The doctor willingly took these vaccines. The doctor then went home and had his family vaccinated, and then encouraged the vaccines on all of his patients, thousands and thousands of patients. Can you imagine the day of reckoning when we say, well, the vaccines cause heart damage, they cause blood clots, it's in the package inserts, it's in the important safety information. The doctors at this point in time, it is a willful blindness. They can't bring themselves to the realization that they've done harm. It's the same thing with smoking. In The Emperor of All Maladies, which is a great book, there's a description of a lead surgeon at Johns Hopkins, and he's smoking while he's taking out lung tumors. And the smoke is grayish black as he's blowing in the air, and the lung tumors are black. And he's saying smoking cannot cause these lung cancers. He fought that to the end. He himself died of lung cancer. It's the same willful blindness. Part of it is the personal nature of this. The doctors and these large medical organizations all took the vaccine. There's only a tiny fraction of doctors. I didn't take the vaccine, so I can freely talk about it. I didn't recommend it to my patients, so I can take a fair, balanced view of this, and I have. the doctors have taken the vaccine. It's like all the doctors taking Vioxx, a drug that had safety concerns, and they all take Vioxx, and they all think it's the greatest thing. When it comes down to Vioxx, provoking heart attacks, no, Vioxx can't do that. It has to do with the personal nature that they've all taken it. And there's a sense here that if they took the risks and they're okay, that others should take the risks too. And so there is, with vaccines, in this vaccine ideology, if some people are injured or sadly die, that's collateral damage, but that's expected. They should do that for the better of society.
Where do you stand on the suggestion that's made by credentialed serious people that there was no new disease circulating? That SARS-CoV-2 was never meaningfully isolated and identified, and that therefore COVID-19 was not a new entity. I hear that, when you run it through, when you war game it as an idea, it is frightening, because then when you come to this lab leak story that's now on the US government website, it exonerates all the guilty parties. If something new was circulating and could be described as dangerous, then they'll always be able to stand up and say, well, we had to do something, and we may have made some mistakes with some of the legislation and some of the rules, but we had to do something to save you. Where do you stand on all of that?
Well, I have the advantage. You're describing what we call the virus deniers. I have the advantage of being a doctor, and I directly saw and examined patients with this illness. I had patients die with this illness. Let me just say this much. This is not influenza. I will tell you that with great medical authority. It's not influenza. It is a very unique syndrome. This virus causes blood clotting like we've never seen before. Blood clots, the largest blood clots I've ever seen. Influenza doesn't do that. Paramyxovirus doesn't do that. Rhinovirus doesn't do that. Respiratory syncytial virus. So it is a unique clinical syndrome. Okay. The virus itself. So the virus has been clearly isolated and cultured. That's how the Chinese make the Sinovac vaccine. They grow the virus up, they culture it, they isolate it, and they kill it, and they administer it as a vaccine. So it's clearly been cultured and isolated. The genetic sequence is known. Every single amino acid and protein in that virus has been identified. You can actually see the virus on electron microscopy. You can see it invading cells, multiplying, and then bursting the cells. So for the virus deniers, I just think it's, it's kind of like a convenient colloquialism. It's kind of a clever thing. Well, it doesn't really exist, but I don't think it's something that's advancing our understanding of what's going on right now.
Although, let's say it exists then. To me, what matters most is what was done in its name. I mean, whatever it wasn't dangerous. The people who were dying of it were in the main over life expectancy with comorbidities. Mm-hmm. And the numbers were boosted by all this stuff around, if you died within 28 days of a positive test, you were counted as having died of COVID rather than the cancer that actually carried you off or whatever. That it was a pandemic of testing. Mm-hmm. with a product that was not diagnostic and was forensic, and so on and so on. And yet in its name, whether it existed or not, it was the theft of wealth, it was the theft of freedom, it was the altering the very fabric of society and the way that we relate to one another and to authority, and obviously holding over us the sword of Damocles possibility of it all happening again if the authorities are able to say, well, we had to do something.
Well, for sure. In the United States, we have 13 BSL level 4 labs, including one in Galveston, Texas, where I am. I'm in Dallas, Texas. We have over 140 BSL level 3 labs. These are richly funded by government agencies, by foundations. The race is on now. Can you imagine if you create a biological threat to humanity and you hold that in your hand, and then you hold an answer, a countermeasure, a vaccine, a therapeutic? Can you imagine the power that's held? That's like holding a nuclear weapon and a defense system all at once in 2 different test tubes. We've never seen such interest in this and it's been going on for decades. It's nearly completely unregulated. The Biden administration put out legislation last summer that, voluntary reporting, very loose. It's called Developing Pathogens for Dual Purpose. Develop a pathogen that can get the whole world sick, and then develop a vaccine that could, help prevent people getting sick. There's so much money in this. There's so much power in this. You can see how brazen people are. So, for instance, Tedros Ghebreyesus at the WHO has said there's going to be another one of these, a disease X. Another promoter's Peter Hotez at Baylor in Houston. There's going to be another one. We could unleash another one. These people in the know, Bill Gates, there's going to be another one. So all these experts who are in what we call this biopharmaceutical complex, they are all predicting another pandemic because the next source of the pathogen is going to be the lab, just like SARS-CoV-2.
You talk about power. You mentioned the WHO. What about, do you take any, or how do you read the stepping down, the stepping away from the leadership of the World Economic Forum by Klaus Schwab? Does that mean anything? Does that mean any sort of rattling at the foundation levels of globalism, or is it just a restructuring and a changing of the guard?
I think it's just a restructuring or the changing of the guard. Remember, one of his pupils is Yuval Harari. He's someone who's considered just, honestly, just an evil transhumanist to his core, someone who hates humanity. The World Economic Forum is almost like the villains in a Bond movie, a James Bond movie. It just, the deviance in their thinking. I analyzed one of the Davos meetings schedules of presentations. It's called the World Economic Forum. Do you know how much time they spend on economics? About 22%.
Very little.
Very little. They're spending time on science fiction, how to make people miserable with, social engineering, 15-minute cities, doing everything they can to, in a sense, create this duality of a super elite, long-lived group of rulers and then a bunch of servants. Yuval Harari, is the one who coined the term useless eaters. That's in his view, that's what we are. But Klaus Schwab people have to pay attention to what he wrote. He wrote the Fourth Industrial Revolution, 2017, and he wrote at that time that the environment is no longer going to change. We're going to change humans. That was a transhumanist manifesto. And, one of the ways humans are changing is by taking vaccines, because once they're injected, we cannot take them out of the body. And as we've covered, it looks like they are a risk factor or a trigger for autism. The COVID vaccines are clearly a risk factor for multiple different forms of illness, disease, shortened lifespan. It's a miserable experience. And then he wrote the Great Reset. He wrote that 3 months into 2020. That's when it was published. This is astounding. And said, yes, the pandemic will be an opportunity now, a unique window of opportunity to reset a new world order. Well, what did Schwab mean, the new world order? Does that mean he's on top and I'm on bottom? There's an order to it. So the World Economic Forum is a very frightening organization. I hope people can start to understand this. This Davos meeting ought to be boycotted. People, the one theme we're seeing here is there's no world leader who's going to save us from this. There's no world leader. I mean, even Robert F. Kennedy, since he's been installed in office, has not said that he wants to see the COVID vaccines pulled off the market, despite a devastating number of injuries, disabilities, and deaths. So there's no world leader who's going to save us. The theme here is that we seem to, as a population, have to be able to interpret what's going on and save ourselves.
I mentioned anti-humanism earlier, and I'm convinced of it. Where does it come from? And the ideology that you just sketched in there from the World Economic Forum and other agencies like it. Why in the 21st century are the elites so blatantly anti-human?
I can just observe, not being a sociologist, none of those individuals profess to have any spirituality. None of them. None of them profess to even, express their spirituality in a formal religion. None of them seem to acknowledge a higher power than human beings. In fact, they view themselves as a higher power. So, in many ways, one in a religious context could conclude that this anti-humanism at these very high levels is, in a sense, a representation of evil. I've been all over the world through the pandemic. I've been invited to lecture in India and Europe and all over the world. And even Hindus and Muslims believe this, that we've entered a time now where we're in an epic struggle between good and evil.
And as you say, and I think you're right, there's an inevitability, I think, to the necessity to accept that no one's coming to save us from the point of view of a political leader, a head of state, and that's not going to happen. It's not going to be a political party. Mm-hmm. I think that's demonstrable. Maybe, or is it? If I can make it a question, is it that necessity for each of us to take individual responsibility, rather than looking over our shoulders for a knight on a white charger? It's us.
Mm-hmm. It seems to be a message here, and whether it comes to young parents making decisions regarding risk factors for autism, these decisions that we had to make through the pandemic, were we going to go through with all of this masking and social distancing and ending our livelihoods? Are we going to stand up? And it's so interesting to see. I had a chance recently to meet Art Pawlowski from Alberta, and he refused to close his church. For a period of time, they put him in solitary confinement. They literally put him in a cement block and turned off the lights. What was in the hearts of those Canadian authorities to do that to a pastor? I mean, it's astonishing. Again, a representation in the sense of evil, almost satanic or demonic, trying to injure someone who is bringing people to God.
Yes, it's a profoundly challenging time. I think the COVID story opened, as perhaps an unintended consequence, it opened a door.
Yeah.
Or it has, for the first time in a long time, inspired numerous people that speak to me every day to see this as something profound. Existential is a word you used earlier. Mm-hmm. But it does feel like light and dark, right and wrong, good and evil.
Yeah, I think you put a good punctuation mark on it. There's no doubt about it. I congratulate you and the independent media. I've had a chance to go on Joe Rogan's podcast and be watched by many tens of millions of people, and it really opened his eyes. Same thing with Tucker Carlson. I went on Tucker Carlson. He kept saying, my mind is blown with what I'm hearing. And then Tucker went on a pursuit that ultimately cost him his job at Fox News. And we keep going and going. Novak Djokovic, the world's greatest tennis player. Aaron Rodgers, at the time, our greatest pro football quarterback. These are astonishing observations that we're seeing. But there's no country in the world that's done in a safety analysis on these COVID-19 vaccines. Not a single one. There's not a single country in the world that's opened a vial of the vaccine and done an inspection of the ingredients in the vial in a search for contaminants to assess purity. Not a single country. And certainly not a single country has pulled the COVID-19 vaccines off the market. We are over 4 years into the most deadly vaccine campaign in human history. We are in astonishing times. Historians are going to look back on this and say, my Lord, what got into the minds of people for such a prolonged, sustained period of time?
I think that's the perfect thought to end on. Dr. Peter McCullough, thank you so much for being so generous with your time. It's been a privilege to listen to you, and I'll look forward to perhaps picking up this conversation another time. Thank you very much.
Thanks for having me.